Good afternoon, everyone, and thank you for joining us on this Tuesday afternoon for this live conversation on the COVID-19 vaccine. You may recognize our guest, Chief Infection Prevention Officer, Dr. Marci Drees. Dr. Drees, thank you so much for joining us once again today.
Thank you for having me, and welcome to everyone who's joining.
So before we get started diving into all of our vaccine questions, can we just get a basic overview of the state of COVID-19 in Delaware right now?
Sure. So Delaware is one of the states that actually has seen a recent increase in COVID-19 cases over the past month or so. Not as dramatic as what we saw in the fall or even what's more recently been happening in other states like Michigan. But we have seen a rather sustained increase compared to February and early March. The state pushes out kind of measures of community spread, specifically the average new cases or average daily hospitalizations, new cases rate, and percent positivity of testing as a way to kind of gauge community spread. And those metrics have been up pretty consistently over the past 4 weeks. Although this past week, they were starting to improve a little bit. 2 of the 3 were improved. So it's a little too early to say whether that's a clear downward trend. So unfortunately, COVID is still very much with us and has, at least recently, has been moving in the wrong direction.
So the most important reminder off the top of this conversation, continue to wear your mask, physically distance, and wash your hands, whether you're vaccinated or not.
Yes, absolutely. And, we know that we're seeing more and more variants in Delaware as well as throughout the country. So, whenever you're around somebody who's not in your household and you don't know their vaccination status, it's always safest to wear your mask and stay, socially distant.
Absolutely. So diving into the vaccine questions, obviously the hottest topic right now is Johnson & Johnson. And a few days ago, the CDC and FDA lifted the pause on that Johnson & Johnson vaccine. Can you give us context of what caused the pause and then why it was lifted?
Sure. So this is a great example of the system working. So, there has never been a more robust safety monitoring system for a new vaccine, ever. There are multiple systems in place to look for just such a safety signal as was seen after the J&J vaccine. So what they saw after about 6 million vaccines had been administered, they saw 6 cases of a fairly rare type of blood clot called a cerebral venous sinus thrombosis, or CVST. And this was clearly not above the expected rate. And it was also associated with a low platelet count, which is not what's typical for this type of blood clot. So that was a clear safety signal. It was, and really within 24 hours, they had put the pause on any further administration of J&J vaccine. And within 48 hours, they had convened a meeting to really discuss in detail what did we know. They did not make a decision at that time because they felt like they needed to know more. They were worried that other cases were still out there that hadn't been reported. And so they met again this past Friday. And I think, as everybody's aware, the pause has been lifted. And the reason for that is because even though this does appear to be a real association with the vaccine, the rate is very low. It does seem to be more concentrated in women aged 20-ish to 50, although not exclusively. And they felt like, if they banned the use of the J&J vaccine altogether, that people would be harmed, people who are really at low risk. And also, we know that some people really want that 1 dose option, and either, because they can't get out of work, they can't make 2 appointments for 2 different doses, or for populations that are just harder to reach and harder to find for their second dose, that J&J vaccine is a really important tool in the toolbox. So they really wanted to leave it up to flexibility for public health jurisdictions and for individuals to make that choice for themselves in terms of what they value. Do they really value the 1 dose option? If so, they can go ahead and take it, knowing there is probably a real but very, very low risk of this particular type of blood clot.
As you mentioned, that risk is low, but it's there. So if someone gets the Johnson & Johnson vaccine in the coming days, what should they be looking out for in terms of potentially concerning side effects?
Yeah, so the CVST, again, is a blood clot in the vessels of the brain. So the most common symptom of that is a severe headache that doesn't go away. It doesn't have to start, all of a sudden. It can build up gradually over time. But blood clots can happen in other organs as well. Some of these people had, blood clots in the vessels in their abdomen, so they presented with abdominal pain. You certainly can see leg pain, shortness of breath if a clot is in your lungs. So really anything like that that's severe enough after the J&J vaccine. These all presented, at least a week after. So this is not really similar to the kind of expected side effects that we might see a day or two after getting any of the COVID vaccines. It does seem to be a little bit delayed, but presents again between 1 to 3 weeks later. So if you're in that time frame after a J&J vaccine and you've had some of those severe symptoms, you should see help from your physician or other types of care.
And what about the side effects everyone should expect, whether you're getting Johnson & Johnson or Pfizer or Moderna? What should someone expect no matter what?
So, our experience is that it's highly variable. So many people have no side effects at all, or have just a typical sore arm like you would have after any vaccine. And this one is not particularly different in terms of severity of that. The other side effects that we warn people about, not that they're absolutely going to have them, but they could, are just, they can be signs that might be similar to a mild COVID infection. So fatigue, a mild headache, some body aches, rarely some fevers or chills. Again, they don't tend to be severe. And though, most people will notice a little bit. Some people feel like they don't want to work or can't do their activities the day after they get their vaccine, but that's really the minority. Most people really, in our experience, have done fine. And the good thing is that even if you do have some more severe side effects, they do seem to, they go away after 8 to 12, 24 hours at most. So, so it's something to be, aware of that you could experience, but it certainly isn't a guarantee. And many people.
I think it's important to point out that everyone is different. I personally received 2 of my doses and really felt okay. I know others who it really, put them out for a day or so, and they were really tired, had a slight fever. So everyone is different, and that's important to note as well.
Yeah, and they say that, you're more likely to have more side effects the younger you are and less likely the older you are. But again, in my experience, it's been really variable. There's definitely been people older than me who had worse side effects than I did, and vice versa. So again, it's very hard to predict and just something to be aware of. And all of them really are a sign of your immune system ramping up to learn how to fight COVID. So it is expected, and it's nothing to be worried about. You can take Tylenol or ibuprofen, for symptoms if you do experience them, and so they're easily treatable and they don't last very long.
Absolutely. So we have our first submitted question. Rebecca asks, when can minors under the age of 16 get the vaccine, specifically ones with medical conditions?
Yeah, so that's a great question. So again, as she mentioned, so 16 and 17-year-olds are currently able to get the Pfizer vaccine, but not the Moderna or the J&J because it wasn't studied in that population. But all 3 companies have actually already enrolled children down to the age of 12. And those studies are being analyzed as we speak. And there's been some preliminary data that's been put out via press release. So we haven't seen the official data yet, that really suggests that the antibody levels in that age group are just as good, if not better, than compared to young adults, in their 20s. So we expect that the companies will submit to FDA for emergency use for that age group, 12 and up, probably sometime later this spring or early summer. And so I think we have every indication that at least 12 and up will be able to be vaccinated before the fall, which is important for schools. And then, as they move down, they'll be moving down in age groups. So I think they're starting to enroll now, down to age of 5, and eventually they'll actually enroll down to the age of 6 months. That becomes a little bit more complicated, partly because kids those ages don't tend to get symptomatic with COVID if they do get it. And so you have to look for other signs of protection like antibody levels. And also you have to worry about dosing. Obviously, you can't give the same dose of a vaccine to a 6-month-old as you give to a 20-year-old. So there's some work still to be done about figuring out what the best dose is for that population as well. But so I think it probably won't be until 2022 that we can get younger kids vaccinated. But like I said, at least 12 and up should be later this year.
So you mentioned the 6-month-olds. I know there have been numerous studies about the benefits of mothers who are pregnant being vaccinated, breastfeeding mothers being vaccinated. What do we know about that and the safety in connection with infants and toddlers?
Yeah, so, as is typical of many clinical trials, pregnant women were not enrolled in the original trials. And so we really couldn't say anything about safety or even or effectiveness of the vaccines. Now, we knew that biologically, there's no reason why the mRNA vaccines would have anything to do with a fetus or with breast milk. So, biologically, it seemed plausible that they would be safe. And we know from rat studies that there was no evidence of any harm to the fetus. And so when the vaccines were originally approved, women were given the choice. If pregnant women wanted to be vaccinated, they could. They were not forbidden from doing so, which I think was definitely the right thing to do. But once pregnant women started being vaccinated, many of them were enrolled in registries to monitor their safety. And so we've had, I'm sure the number is higher now, but the original safety data in pregnancy that was released, I think, back in January, there were more than 30,000 pregnant women who had been vaccinated and were enrolled in this ongoing monitoring with no evidence of safety issues for the baby. So and that has continued on, that there has not been a safety signal in pregnancy or in breastfeeding women. And certainly there is definitely the advantage if you're breastfeeding that you're passing along those antibodies to your baby. And even once we have a vaccine that goes down to the age of 6 months, under 6 months is still not going to be able to be vaccinated. So they really rely on those maternal antibodies to protect them against COVID. And again, the rate of severe illness in that age group is very, very low, but it's not zero. So if there's a way to protect the fetus and the young child, we certainly should do that. And the other reason we wanted pregnant women to be vaccinated is that we know that their risk, should they get COVID, of having a severe outcome like being hospitalized or in the ICU, being on a ventilator, is higher than a non-pregnant woman. So that's the other reason. Obviously, we want to protect the mom as well as the baby by vaccinating.
Absolutely. So the CDC recently came out and said it was roughly 5 million people have missed their second dose. So if they're getting Pfizer or Moderna, they received their first dose, but not their second dose. Could be for a variety of reasons. But talk about the importance of getting both doses.
Yeah, I mean, like you said, there can be a lot of reasons why people don't get their second dose. So some of it may be because they had a allergic reaction to their first dose and they're not recommended to get their second dose. But I think some of it may just be the logistics of getting back into a clinic to get the same type of vaccine, because we don't want to mix them up unless we absolutely have to. But it's important to get both doses because if we think back to all the vaccines most of us got in childhood, we got multiple doses of every single one. And the reason that we do that is because vaccines, you need multiple doses to both get the highest antibody level you can possibly achieve, as well as to have that protection last as long as possible. So when you only have one dose, we know that you're not getting to the highest protection possible. And we also don't really know how long your protection is going to last, because the trials, 98 or 99% of people in the trials got both doses, and they're being followed for up to 2 years to see how long their protection lasts. But we don't have that kind of data for people who only got one dose because they're not really formally being studied. So, and we know that, we have a number of different variants out there, and most of them, the vaccines still work pretty well against, but it may not be quite as high as against what we call wild type virus. And so another reason why you want your antibody levels to be as high as possible is to give you better protection against these variants as they emerge as well.
So coming off of that, we have another question. Terry asks, I got the Pfizer first shot and had some bad reactions with it. Do you think I will get the same reactions with the second shot, or do you think they will be less? Terry is nervous and would like your opinion.
Yeah. So, again, it's very unpredictable. What we've seen is, and this may not be your situation, but people who say have had COVID and now they're getting vaccinated, they have side effects after their first dose that's similar to what other people get after their second dose. So it's like their original infection kind of primed their immune system, and then they get a greater reaction to their second dose. But once they get their second dose, their side effects are not any worse. They're mild. So I think that, side effects after the first dose do not necessarily predict side effects after the second dose. We tell people to be aware that they could be worse. And maybe, if you're able to get the vaccine on a day before you have a day off from work, for example, so you don't have to call out, that's always advisable. But it doesn't predict what's going to happen. Now, if you had a severe allergic reaction to the first dose, then you should not get the second dose. There is an option if you got, the Pfizer, the Moderna, and you're not advised to get the second dose of that one because of an allergic reaction, you can potentially get the J&J vaccine. But I certainly would talk about kind of what exactly your reaction was and how to proceed, with your doctor or with an allergist.
And if you, as you mentioned, speaking with your doctor, if you have that kind of reaction that could be concerning, the first thing you should do is reach out to a medical professional.
Yeah.
So let's talk about herd immunity, because some people are saying, I'll just wait it out. Herd immunity is coming. I don't need to get vaccinated. I'll wait it out. But how far away are we to even have that conversation?
Yeah. I mean, the problem is we don't really know what level we need to achieve to really get herd immunity. We know that the more contagious a virus is, the higher proportion of people need to be vaccinated to prevent outbreaks. So for, the best example of this is measles, which is the most contagious virus known to man. And if we don't have, community vaccination rates of at least 95%, we'll start to see outbreaks of measles, which is what we saw, 3-4 years ago. With little pockets of unvaccinated people, we were starting to see measles outbreaks. So we know that COVID-19 is not as contagious as measles, thankfully, but as we start to see the variants that we know are more contagious, that level of herd immunity, it needs to go up. So initially, I think, experts are saying, well, maybe if we get 70%, or even 50 to 70% of people vaccinated, that's going to be enough. But now that the variants are circulating, I think that estimate has gone up to 70 to 85%. But we don't really know, and because it's kind of a it's kind of an abstract concept, and we won't know until we actually start to see enough people vaccinated that the rates start to come down. And I mean, we know that people who have had COVID and had COVID infections are also have at least some transient immunity. But we don't really know how long that lasts and whether it's as strong as what you get after a vaccine. And especially, there's some evidence that if you had a relatively mild case of COVID or even an asymptomatic case, you're not going to have the same sort of a robust antibody response as if you had a severe case. So, initially we were saying, well, if we have, 30% of the population had COVID and another, 40% are vaccinated, that might be enough. But I think, we're starting to see, well, the more people we actually get vaccinated, the better protected we all will be.
And what about those who have been fully vaccinated, maybe at this point, for a few weeks or a few months? Are they still at risk for contracting COVID? We hear about these breakthrough cases, but what does that actually look like?
Yeah, so I mean, no vaccine's 100%. Even again, the measles vaccine, which is highly effective, 97%. That's still not 100. So it is absolutely expected that we will start to see some cases that occur even in fully vaccinated people. And when we say fully vaccinated, that means it's been at least 2 weeks since their second dose or their only dose if they got the J&J vaccine. If you can certainly get COVID before that, if you're exposed, because you're not fully protected yet, while your body is still responding to the vaccines. The CDC did report last month that about 6,000 cases of breakthrough COVID infection had been reported, but that was out of 84 million people that had been vaccinated. Now that may be an underestimate to be sure, but it's less than 1 in 1,000 of people who've been vaccinated who have been had a case be reported. And we certainly, we expect that the cases that do happen should be milder than if you had not been vaccinated. And we see that with other vaccines as well. And we certainly expect to see that with COVID, and we have been experiencing that.
So knowing all that we know, we have about 10 minutes left in this conversation, and let's talk situations. It's almost May. Tomorrow was supposed to be, sunny and 80 degrees. What can people feel comfortable doing? Seeing others, visiting friends. What kind of is okay, and what should we continue to worry about?
Yeah. So, there are all different levels of risk. And so you have to kind of gauge, the situation of, are you indoors or outdoors? And we know that CDC is going to be putting out some updated outdoor guidelines later today. We haven't seen those yet. But in terms of indoor settings, if you've been vaccinated, you can feel comfortable being indoors without masks with other vaccinated people. And even if there are a few individuals that aren't themselves vaccinated, so say kids, who aren't able to be vaccinated, as long as they're low risk and everyone else is vaccinated, you can also feel free to be indoors without masks. What you don't want to do is, go out to large group settings where you don't know people's vaccination status, or there's still some issues with travel, but and which we can talk about in a second. But certainly, outdoors is safer than indoors. The more people in your group that are vaccinated, the better. And then still, have your mask so that when you are around people that you don't know their vaccination status, or if they're high risk, because they're older or they have a medical condition, that you still are protecting them by wearing your mask.
So it's funny you mentioned that, because I just got the alert the CDC is getting ready to speak right now, which before this we said of course that would happen. So
yeah, so more to follow.
Yeah, absolutely. If you're interested in hearing those updates, we will also be sharing them on this channel and all of our other social channels this afternoon. So keep an eye out for that as we update that as well. So Dr. Drees, before I let you go, what is the most important thing you think people should take away from our conversation here today?
Well, I think, we're now, more than a year into this. And I think a lot of the COVID experience has been about things that we can't do, right? We can't travel, can't see our family, we're stuck at home, or, we've lost our job, whatever the case may be. It's all about, we can't, and people are tired of it. I understand that. We're ready to just be done. But so what I think people need to realize is that we now have like 3 highly effective tools that we can take action. This is something we can do to protect ourselves, to protect our community, our loved ones, and to get through this so that we can start to do all those other things that we have not been able to do for the past year and a half. So I really encourage everyone to take that action if you haven't already. And figure out what the best option for you is in terms of that vaccine and when to get it, but to go ahead and get vaccinated. I think,
and if you're watching and you haven't been vaccinated yet, but you're interested in doing so, there will be a link in the comments below to ChristianaCare's website and the form where you can sign up and get on the list. There's also a state of Delaware list that you can get on as well. And please, and Dr. Drees, I'm sure you'll back me up on this, get the first vaccine that is offered to you. Do not wait.
Absolutely. Yep.
So thank you so much. And if you're watching and have any follow-up questions for Dr. Drees, please leave those in the comments and we will get to them. And as we mentioned, we'll update any of those masking guidelines or any other updates coming out today and in the coming days. Please continue to follow us on Facebook and any of our other social platforms. Thank you so much and have a great afternoon.